have 19,015 confirmed aggregate cases of coronavirus in Victoria. That's 114 new cases since yesterday's report. I'm saddened to have to update you that there are now 524 Victorians who have lost their life due to this global pandemic. That's an increase of 11 since yesterday. Of course, our thoughts, prayers and best wishes are with the families of each of those 11 Victorians. We send our deepest sympathies and our profound condolences to them. Those 11 include one male in his 70s, 5 females and 1 male in their 80s, 3 females and 1 male in their 90s. 9 of those 11 deaths are linked to outbreaks in aged care. There are 472 Victorians in hospital. 25 of those are receiving intensive care and 11 of those 25 are on a ventilator. A total of 2,210,447 test results have been received, which is an increase of 14,231 test results since yesterday. Can I again just urge each and every Victorian with even the mildest of symptoms, as soon as you have system onset, as soon as you begin to feel even moderately unwell, scratchy throat, runny nose, cough, headache, all of those well-known and well-understood coronavirus symptoms, please visit one of the more than 190 test sites across the state. Getting tested quickly as soon as you begin to feel unwell, even very mild symptoms, and then isolating at home until you get your test result, which is now averaging just under 1 day, is a profound contribution that you can make. It's such an important thing to give us the most complete picture of how much virus is out there, how it's presenting, chains of transmission, giving us the most accurate and complete picture so that we can make the best decisions about the next phase and indeed the one after that. So again, I would urge all Victorians, please come forward and get tested if you've got even the most minor of symptoms. It's such a big, important and powerful thing that you can do. Quite a simple thing, but it makes a massive difference. There are 4,226 cases with unknown origin. That is an increase of 3 since yesterday's report, so 3 cases closed out by our coronavirus detectives over the course of the last few days. There are 406 healthcare workers who are active cases, and we again send our best wishes to each of them. We thank them for their care and compassion and their commitment to providing only the best care to their patients. We send our best wishes to them, and we thank them and their colleagues, those who are at work right now and every hour of every shift in every part of the state. They are heroes and are doing an amazing job, and we're deeply grateful to all of them. That's why the decisions that each of us make as families, as individual Victorians, every choice you make ultimately is one between whether more healthcare workers will be exposed to this virus and become ill or less. So if we want to thank them for the work that they do every hour, then let's all see this through and let's see this second wave off by driving those numbers down further and further. That only happens by us all making the right decisions, and that's why we're so grateful, so proud of the vast, vast majority of Victorians who are doing the right thing. There are 2,830 active cases across the state. That number continues to fall, which is good news. Just quickly, in terms of the regional metro split, 166 cases in regional local government areas under stage 3, so those numbers continue to fall, and that's very good news. In Greater Geelong, 55 active cases, 3 new. Greater Bendigo has 10 active cases and 0 new cases. And Ballarat has 6 active cases and 0 new. So those 3 communities, or greater communities, that we were concerned about a few weeks ago have not just stabilised, those numbers are being driven down, and we're deeply grateful, not just to regional Victorians in those communities, but in every part of regional Victoria. There are rules, they're being followed, great sacrifices being made, but that strategy is working, and to have that small number of active cases and a steady decline in active cases is very encouraging indeed. In terms of aged care, as at the 30th of August, we have 1,277 active cases. In terms of just a minor clarification, but one that is important, as per this morning's Victoria Aged Care Response Situation Report, the total number of deaths associated with aged care outbreaks is now 382. I'm advised that one previous death has been recategorised and unlinked from an aged care outbreak today. So while there are 9 new deaths linked to aged care outbreaks reported in today's update, the difference in cumulative total compared to yesterday is in fact an increase of 8. I hope that makes that clear. Now, just before I ask Dr. Anthea Rhodes from the Royal Children's Hospital to talk about one impact that the pandemic is having in relation to care and support of our littlest Victorians, and that principally relates to the numbers of parents bringing forward little bubs, bringing forward their children to be vaccinated, to get the important jabs that they need in order to be fit and healthy and to protect the entire community. I just wanted to make a couple of comments about where we find ourselves. These numbers are coming down. We will see some variation day to day. They'll bounce around a little bit. But in general terms, we're seeing a fall across each of the key metrics. The strategy is working, and that's a credit to every Victorian who's made a powerful contribution to that end. But we just have to stay the course on this. At 100, at 94, at 114, whatever the number around that number, we simply could not open up. Those numbers would explode. We would finish up in perhaps an even worse situation than we have been in recent months, and we can't fritter away all of that good work, all that sacrifice, that pain, the challenges that every Victorian has endured and worked through. We can't have that count for nothing. So what we have to do is stay the course on this. Once we see these numbers fall further, and once we have certainty, and that will be quite soon, we'll be able to talk in more definitive terms about what the weeks and months ahead look like. I understand that and appreciate fully that everybody wants that clear sense of what the next steps will be, but they need to be announcements that can be relied upon. They need to be announcements that are based in the best of health advice, in data, in science, in the evidence. And what we can be certain of right now, these case numbers are too high for us to open up, and they are still too high for us to put forward a definitive plan. Now, there will be a plan. It will come soon, but it will be one that we can be confident of, not something that potentially gets us a few weeks of people being happier, but then ultimately has to be revised because it didn't mean much when you first announced it. I know that's challenging. I know everybody wants this to be over. Nobody more than me. We all want this second wave to be defeated, but it needs to be defeated properly so that it's not some smouldering fire that then takes off again and potentially burns more intensely than it ever has. We simply can't have that happen. So there will be a time soon where we can talk in more definitive terms about what the weeks and months ahead look like. I'll make some announcements tomorrow in relation to how we're going to engage with industry, for instance, to make sure that we're getting the latest and best input around what that opening up should look like. That is not for today. It will be as soon as it possibly can be, and we will give people as much notice as we possibly can. We understand the need and the urgency and that sense of fatigue. It's perfectly reasonable, but all of us have to stay the course on this and defeat this second wave comprehensively. Otherwise, we won't be able to lock in to a COVID normal with any certainty that those arrangements can be stable and long-lasting, and they may need to last for many, many months. We want those to be the lightest touch set of rules possible, rules that balance both the protection of public health, but also, so protecting lives, but also protecting livelihoods and making sure that we can open back up again, rebuild businesses, repair the damage that this pandemic has done to us right across the state. That, I think, is best done where you've got the greatest certainty that those rules can stay in place, because you've driven case numbers down to such a low level that any outbreak, that any additional positive case, we can literally pounce on that and make sure that it is contained. That's what we're working towards. That's what the strategy. It is working, and it is making it much more likely that we can get to that place. But it's still just a little too early for us to be able to map out an absolutely definitive plan. That's the honest, frank, and upfront position that we find ourselves in. I'm not going to stand here and make announcements that as I make them, I really have no confidence that I'll be able to deliver them. I don't think that would be fair. But it won't be much longer before we can have some more detail we can have more to say in more detail and with the certainty that I think every Victorian is absolutely entitled to.